Okay, so we're gonna do a little video on the devastating effects of methamphetamine use. Highly addictive substance, methamphetamines. Obviously, I did a bunch of it back in the day, right? What are we gonna do here? Put that right there, like that. Okay. So, it's crazy because I did so much. I experienced a lot of these short-term effects. I wanted to just talk about the short-term effects and the long-term effects of using methamphetamines, right? It causes severe physical and psychological harm. It can lead to a short-term and a long-term. It can lead to short-term and long-term harm, right? Health consequences affecting nearly every organ system in your body. Now, I'm gonna go over 8 short-term effects, and then I'm gonna go over what is it, like 8 short-term effects and 5 long-term effects. Okay, so let's get into it. Here we go. Number 1, cardiovascular system: increased heart rate, high blood pressure, right? Heart attack. Okay, is the first short-term effect. It just increased heart rate and high blood pressure, which leads to the heart attack, which is a long-term effect. But we're going to just go with the short term right now. Number 1, cardiovascular system. Number 2, your nervous system: agitation, anxiety, aggression, insomnia, sleep disturbances, seizures, tremors, hallucinations, and psychosis, right? These are all short-term effects in the minority. Like there's obviously long-term effects of psychosis, hallucinations, seizures, and tremors, insomnia, sleep disturbances, but there's also short-term effects. You'll experience these with short-term use as well as long-term use, okay? Number 3, respiratory system: bronchitis, pneumonia, respiratory failure, pulmonary edema, right? This is with short-term use. Respiratory failure, bronchitis, pneumonia. This is with short-term use. Luckily, I didn't experience any of that. But with this next one, number 4, gastrointestinal system: nausea, vomiting. Never really experienced that. Diarrhea, abdominal pain. I experienced a little abdominal pain, maybe some diarrhea every once in a while. But malnutrition and dehydration. I remember my mouth would get so dry. I would drink water. Like, I would be sitting there doing work and working on stuff, and I remember like some batches, I guess, was different, but I would have extreme dry mouth, and if I try to smoke some weed on top of that, oh man, I felt like Jim Carrey on the movie Me, Myself, and Irene, where my mouth was just so dry. So that is number 4. Number 5, short-term effect: integumentary system, which is your skin: acne, skin lesions, skin picking, sores, poor wound healing, dry, itchy skin. So it really affects your skin using meth, right? Number 6, which I also experienced, like some dry, itchy skin a lot of times too. Number 6, musculoskeletal system, like muscle weakness, wasting, like osteoporosis, which is what it leads to, right? Which most people don't experience until they're like 40 or 50 years old. But also muscle breakdown, also severe dental problems, right? Number 7, reproductive system: decreased libido, fertility, menstrual irregularities, infertility in women, erectile dysfunction, and low testosterone in men, right? I experienced a little bit of the lower testosterone, couldn't perform sometimes, it's like it's got a mind of its own or whatever. It's the dope. You're being controlled by a spirit. You're not yourself, like kind of like with alcohol. You're inviting yourself to the spiritual realm. You're opening yourself up to the spiritual world, right? So yeah, increased risk of unplanned pregnancies and STIs. I'm not laughing because it's funny. I'm just laughing because it's crazy. Get out there and mess around. Now you got somebody pregnant, or you're getting pregnant. Either way, you get a disease, especially if you're shooting up. I never shot it up. I always snorted it. I always like to snort it. But anyway, yeah. Number 8, this is the last short-term effect. Endocrine system, thyroid dysfunction, adrenal insufficiency, hormonal imbalances, electrolyte disturbances, right? Number 8, that's the short-term effects right there. That's your endocrine system, okay? Now, long-term effects, let's get into it. We got 5 of these. Number 1, cardiovascular system. Cardiovascular disease, heart failure, right? So, coronary artery disease, stroke, heart attack, stroke, heart failure. All of these are from a long-term use, of methamphetamines. Number 2, which was one that really frustrated me and angered me and was why I wanted to really stop and get off of it. Another reason why, with neurological damage, memory loss, cognitive impairment, mood disorders, depression, anxiety, psychosis, schizophrenia-like symptoms, and Parkinson's-like symptoms. You know, I don't want to forget stuff that I'm learning. I've been studying, taking notes. I've been trying to gain wisdom and obtain knowledge for a while now on many different topics and subjects. And what would piss me off is I'm studying something for a week, 2 weeks, a month, and then I have 1 or 2 nights of party, and next thing you know, I got to go read back over that stuff and study it because I just lost everything I just learned. I'm putting up bricks and taking down bricks all in the same week, right? Number 2, that was number 2, a long-term use of meth. Number 3, respiratory problems, chronic bronchitis, emphysema, chronic obstructive pulmonary disease, COPD, right? Number 4, long-term effect, dental and oral health. I've already had like cavities. I'm missing these front 2 teeth. Not just because of meth. I ate a lot of candy growing up, you know what I'm saying? Not just for meth, but tooth decay, loss, obviously, gum disease, recession, bleeding gums, dry mouth. Like I said, I had bad dry mouth, and oral infections. I remember sometimes I had to make some tea with some honey in it. I would do some research. That's how I started getting into more oral stuff, and like trying to figure out how to get rid of the some batches of dope I do or smoke or do hot rails of. It would give me this these canker sores on my tongue so bad I couldn't even talk. I couldn't eat nothing. I couldn't even drink water. It hurt so bad I was in tears just thinking about it. Oh my God. But yeah, that's number 4, long-term effects of meth use, long-term, you know. And then the last one, malnutrition and dehydration. I remember walking into places, I had, you know, pretty good build, muscle mass, you know, working out for days, for weeks, for years. I'm, you know, always usually about 200 to 215. I remember getting down to 180, 20, 30 pounds of muscle and fat gone. I'm looking like a skeleton, skinny. I'm walking in places, people looking at me like, this dude is tweaking, you know, like gross. I remember girls used to say, oh my God, what happened to you? You used to be cute. You know what I'm saying? Weight loss, muscle wasting, poor appetite, digestion, electrolyte imbalances, organ damage, and failure. This is number 5 of long-term effects of using methamphetamines. Now, this is the last little thing to wrap up the video, which is a little bonus. MIP, meth-induced psychosis, right? There's 5 little key points: hallucinations, auditory, visual, you hear stuff, you see stuff. Delusions, number 2. Paranoia, right? Persecution, you think people are out to get you, you think people are hating on you, you think the world's against you, you know. Number 3, disorganized thinking and behavior, a little bit of ADD. Ooh, look, squirrel. Oh wait, no wait, okay, oh wait, I'm gonna start this project. No, wait, let me start this project. Oh, I'm gonna come over here. After I've been working on these 2, let me come over here and start that. I'm not even gonna finish these, but I am, but I'm not. You know what I'm saying? Like, it plays with your mind, man. Them demons are playing tricks with your mind, right? Number 4, agitation, aggression. You're angry, irritable, real easily. People just piss you off. You don't know why. You know, they just start talking, they come around you. Why do you always gotta be in the same room talking? Not even to me, but why are you just, you're just mad for no reason, right? Irritable. Number 5, suicidal, homicidal thoughts, which I remember I'm mad at my own self. I'm mad. I'm suicidal. I'm sad. I'm texting people, hey man, I think I'm gonna just give up, man. I'm just thinking I'm gonna find, where I could get like a bottle of Xanax and a couple fifths of liquor, bro. I need to just end this once and for all, bro. Why? What's the point? What's the point in even trying? That's how you think when you're mad at yourself because of all the poor decisions that you've been making. But you should really be mad and sad that you've been, you should be disappointed that you've been making poor, horrible decisions. You shouldn't be sad and want to kill yourself. That's just what the demons are whispering to you and telling you to do. You should just kill yourself. You know what I'm saying? It's crazy. So I experienced a little bit of this meth-induced psychosis, maybe not to the full effect, like walking down the street talking to myself where they say, oh man, look at them, they're far out. They out there, right? I was out there. I wasn't all the way out there, but I was out there a little bit. MIP can be severe, potentially life-threatening. I'm gonna get in here. That's my cue to get in here. But anyway, yeah, man, stay off the meth. I don't know if you out there, if you're doing it, or if you've been doing it, or you used to do it, or you're thinking about doing it. Whatever the case may be, I would just suggest stay away from it. Be victorious. Choose to be victorious. Choose to live for God. Choose to give your life over to God. And once you do that, everything's going to work out. I promise you that. Peace out, y'all.